Philly has been battling opioid addiction for years. One of the new tools at our disposal right now is a large sum of money that the city received as a result of lawsuits against pharmaceutical companies for their role in the opioid crisis. Now, most of that opioid settlement money, $167 million, is going to the Riverview Wellness Village, which is a new long-term recovery housing facility that the city opened in Northeast Philly. But is that the best use of funds? And how else are city politicians tackling this crisis? Emily Rizzo is the accountability reporter at Kensington Voice and is going to break it all down. It's Wednesday, October 8th. I'm Trina Nuri, and we're talking about the politics of tackling the opioid crisis in Philly. Emily, we just learned this week that overdose deaths are ticking downward just a bit in the city. Overdoses fell last year for the second year in a row. And this year, we're on track to have fewer than 1,000 overdose deaths for the first time in 9 years. But beyond the numbers, Emily, are you able to explain where we are currently in Philly with this opioid crisis?
I want to highlight kind of some new reports that just came out of the city that show that the drug supply is still changing. And this new drug called medetomidine is now the most common drug in the supply after fentanyl. It used to be xylazine, which is called tranq, and it's 100 times more potent than xylazine.
That seems to be kind of like a thing that I always hear, like this, like any like new drug that gets introduced on the street, it's just dangerous and more dangerous and more dangerous. That's scary.
It is really scary. And also the withdrawal symptoms are different. So more people now are going to the emergency room for withdrawal symptoms because of this medetomidine drug in the fentanyl supply. Versus like tranq, where people were, suffering from more like flesh wounds. That's decreasing. And now people are just like getting more severe withdrawal symptoms, and they need to go to the emergency room for those. So that's like a stressor on the ER or on our hospital systems. Mm-hmm. And folks are like working to figure this out and address this. But yeah, it's a real public health crisis.
So where we are now is that there is opioid settlement money, and the city has been using the funds to support a number of initiatives. I want to talk about the Riverview Wellness Village. As you report that this is a part of the mayor's plan to tackle the opioid crisis, how many people is the Riverview Wellness Village serving, and what's different compared to maybe other treatment centers?
Yeah. So first of all, how many people is it treating, or how many people have been housed there? The city posted on its website that they've welcomed about 150 people so far. I don't really know what welcomed means. It could be that there's been 150 people who stayed there, and I don't know for how long, right? And that's since it opened in January. And that's also like, there's like about 800 unhoused people in Kensington alone. And it's unclear how many of those folks that have stayed at Riverview are from Kensington or were living unhoused in Kensington.
Right, because the drug issue is citywide.
Yes. So they could be coming from all sorts of different inpatient treatment programs across the city. The requirement to get into Riverview, you have to first complete at least 30 days of inpatient drug treatment. It's not low barrier. Low barrier means you get in, you could still be using and have housing. It's not low barrier in the sense that it's like super easy to get in, and you can get in right away. It's not emergency shelter, right? But it is long term. And I've been told people can stay there for as long as they need until they find even more permanent housing. So that's definitely a positive.
So Emily, you mentioned that 100 people have been welcomed at this facility. Does the Parker administration plan to increase that number?
Yes. And so far they said 150. And they currently, I think the number of beds is around 300 at Riverview. And they're planning on building a whole nother facility on the campus that will increase that number even more. That new building will raise it to about 600.
Emily, is there controversy, though, in terms of how the Parker administration is using opioid settlement money on the Riverview Wellness Village? Is anyone pushing back on this?
Right. So some important context here. In 2023, the Kenney administration decided to put a good amount of opioid settlement money towards specifically Kensington quality of life initiatives. So that was parks, schools, rent relief, home repairs, and small businesses. So that was received very well by Kensington community members and community leaders. But also that initiative, there was pushback. The city faced pushback from this trust that oversees how the city spends the opioid dollars. And public officials, community leaders appealed to that trust, and they actually overturned the board's decision. And this is all important because you had city officials arguing that this money should be spent on children in Kensington who are particularly vulnerable to the risk of substance abuse, substance use disorder, and overdose, and addressing preventative measures like housing stability, access to safe green spaces and learning environments is effective. So that money, the opioid dollars now, are not being spent on those things anymore. And that's what my reporting shows. And
so basically how the Park administration is tackling this is a complete contrast to what was being done before.
Yeah, specifically with the opioid dollars. Yeah. But I also wanted to go back to your question earlier about whether the decision to fund Riverview is controversial. I really plan to dig into that and talk to Kensington community members to hear from them about what they think about this decision. But I do know that the spending on those quality of life initiatives was met with really positive feedback from residents. I mean, and really it was life-changing stuff. We're talking about home repairs that allow people to open their windows, a school that's getting a playground for the first time. Another school is getting a bulletproof fence.
Right. But could those programs that you just mentioned get funded through other measures, though?
Yeah, that's a totally valid question. I mean, but we're also talking about schools that are extremely underfunded. And so having extra pocket money to spend on things specifically to address the learning environment for children and parks someone would describe it a drop in the bucket too for what they really need. But yeah, I guess it could come from city funding for the school district as a whole. But I think just like the argument is that should the opioid dollars be spent on more preventative measures rather than something like Riverview, or in addition to something like Riverview, But I'll add that there also used to be a community-led process facilitated by an outside organization called Scattergood, where community members got to decide where some of this opioid money was spent through these grants. And so it was a community-led grant-making process. They got to decide which organizations got opioid funding. And the city recently, I reported, that decided to end that process and make decisions. And now the city is just making decisions. It was invite only to apply for those grants this year. Some of the previous grantees got the money, some didn't. Next year, not really sure what that process is going to look like. But that was a big deal that community members were suddenly not involved in that decision making. And again, that's opioid money. And now that opioid money is not being used for those grants. And those grants were like specifically for organizations that are addressing the opioid crisis.
Emily, so the trust that manages these opioid settlement funds, they pretty much are in agreement to the various initiatives that the Parker administration has presented.
The trust, well, we'll see. The city has to file a report to that trust now to tell them their plans for the money. And then the trust will either approve or disapprove. The city said to me they believe that spending on Riverview really aligns with the guidelines for this money. And these guidelines are national guidelines because this money is being dispersed throughout the country. So the city believes that spending on Riverview aligns with those guidelines. So they seem pretty confident to me that they're not going to get pushback from this trust. And then, by the way, the city's spending opioid dollars on a few other things as well. But like majority of the money is going towards Riverview. The second biggest investment is into medication-assisted treatment in the city's jails. People need drug treatment while they're incarcerated. That is true. And they need higher doses of the medication that they're receiving in jails.
Another initiative that I wanted to talk about is how the city launched a wellness court in Kensington. And there's a new executive director now that was just recently hired to head it. How does this court operate differently from a normal court in the city? What are people saying about it?
Yeah, it's very different from a normal court. Wellness court is a fast-track court that's meant to divert people into drug treatment after they're arrested for low-level charges. And this is only in Kensington. So what makes it really different is how fast things go here. And also that people are now getting picked up for summary charges when they used to just get tickets. So the mayor signed this executive order that allows police to take people into custody for summary charges. Those are the lowest level of charges you can get. It's like obstructing the sidewalk, obstructing the highway. So that's actually something Mayor Kenny's administration decriminalized. And now Mayor Parker signed this executive order that allows them to take them into custody for those charges. And then they get taken to the wellness center, which is in Kensington, and they get assessed by multiple people, a nurse, other caseworkers, and they decide whether they want to engage with the city's diversion offer. And they then, the same day, get transported to a courtroom, and they stand in front of a judge, and they say they accept treatment, they accept diversion, or they don't. And if you accept treatment, usually you get transported that day, or you get an appointment the next day, and you get a court date so that the city can kind of track your progress. And then you can also reject the diversion offer, and you could go to trial and have a trial that day. Or you can just say, plead guilty and get a fine. People have been walking away with up to $500 fines. So wellness court is only on Wednesdays. Folks are getting arrested Wednesday mornings, and it's so far been a small amount of people each time, like 8 max. And the city has said they plan to expand it to 5 days a week. The city is making improvements to it, increasing resources that they're offering at that wellness center for folks who do get arrested. But critics of the initiative call it a form of involuntary treatment because folks are standing in front of a judge and now involved in the criminal court system where they have to make a decision in the moment whether to engage with treatment or not. And the issue, too, is that people are likely to be high. Many people are unhoused who are being arrested. And so all the complications that come with that are making this really difficult and challenging.
And correct me if I'm wrong, there were some allegations of people dying because of withdrawal in prison, right? Or is that a completely separate thing?
It's not separate. It's a good point because another challenge to wellness court is that if you get arrested and you get taken to this wellness center, Philadelphia public defenders are there. They're stationed there trying to clear people's warrants if they're Philly warrants. But if they're not a Philly warrant, they might have trouble clearing that. And so you could get transferred to a Philly jail or a jail outside of the county. So that is happening. Folks are getting transferred. They get picked up for a summary charge. The city realizes they have a warrant that's unclearable. They have to be transferred. And so that's a big risk here that this is like kind of increasing the stress on Philly jails. And you're talking about people who might have been using that morning or and so are likely to be in withdrawal throughout this whole process, in addition to in jail. And then, yes, the context of this is that there are allegations that people have been dying in jail related to withdrawal symptoms. Amanda Cahill is an example of someone who was recently picked up in a mass arrest in Kensington, and she later died in jail.
We've got more on this conversation after the break. Okay, so we see money going to these initiatives, but a service that will be lost in this drug crisis are the banning of certain mobile service providers who have been out in Kensington helping people with addiction and providing other forms of treatment, right?
Yes. So Councilmember Ketsi Lozada introduced this legislation and it passed, and the Philly Board of Health recently approved regulations relating to this law, and it basically bans mobile medical providers from most of Kensington and mobile providers in general, non-medical providers. And the feedback I'm getting from providers is that it's pretty unreasonable. And here's why. Mobile medical providers are being told that they'll only be able to operate from 11 p.m. to 6 a.m. on 2 blocks of Kensington, or in a certain unspecified location. We don't know where that location is yet. So folks are saying this is unreasonable. These limitations are unreasonable, and it's basically trying to limit mobile medical providers entirely from being in Kensington. And then non-medical providers have to move every 45 minutes. And that is also kind of unreasonable, is what critics are saying.
And there's also like a new licensing process as well?
Yeah. So first of all, this hasn't been enforced yet because it's in limbo. We're waiting on a permitting process to be made available. That's what the Board of Health just voted to allow the Philly Health Department to create and manage this permitting process. So the mobile medical providers have to apply and then receive permits so that they can operate. But it can't be enforced until folks are given the opportunity to apply for a permit. So we're waiting for that to open up, waiting for those applications to open up.
Emily, as I'm listening to you kind of break all this down, it seems like there's a lot of stakeholders involved in this. You've got the Parker administration, you've got health officials, you've got council members, and you also have the community. I mean, can you kind of explain why there seems to be a divide between maybe city leaders and the community in terms of, why even the mobile services vans were banned in the first place?
It's controversial. There are residents who really want this ban. They're fed up. They're tired of seeing these services in front of their homes. They don't want their children seeing people receiving medical services in front of their homes on their way to school. But then there are also residents and advocates who say that not providing these services to people is actually going to make the problem worse. And it's not going to lead to people leaving the area. They're still going to be there. They're just going to have more medical crises, and medical providers won't be able to reach them. So there's definitely two sides of this, but there's a gray area. I mean, I went to a community meeting recently where, people were really listening to each other and empathizing with each other. It's tough, man. I mean, kids are walking to school seeing a lot of things that are traumatic to see. And the question is how to navigate that. And the question is whether removing these medical services will actually address those issues and that trauma. A lot of people say it won't. And people are saying that, medical providers are saying that this is going to make it harder to find people who are even on the brink of wanting to access housing or long-term treatment. And you're cutting off providers' relationships with those folks. And relationships are really what help people get into programs like housing programs and inpatient treatment programs. You have to build trust with folks.
Is any of this working? And is the whole city seeing benefits from all of these different approaches to the drug crisis? Because it's not just Kensington that is impacted. I see it in other neighborhoods where people need help. And at the same time, like you mentioned earlier, our communities have quality of life issues that we want to make sure that we're addressing as well. So, Emily, my question is all of this working? Are we moving in a more positive direction in terms of how we're handling our city's drug crisis?
Well, I'll say first, jury's out regarding wellness court. I'm reporting on wellness court, so hopefully maybe we can talk more about that at a later time, about whether that's working or not. Riverview, also not sure. I mean, these are two new initiatives, right? So we'll see if those are working or not. But I will say our office is in Kensington. It's not looking any different out there. I'd say arrests for drug-related charges are going up. There's really been a crackdown in Kensington. There's been a crackdown on encampments. You can't really have a tent anymore on the street, but there are still a lot of people on the street. And I think some people are seeing small wins. There's a lot of people working on this, but some are saying we need easier access to long-term housing and permanent housing and affordable housing. And that's one way that this is like, we're really going to address parts of this crisis in Kensington. And we don't have enough beds that offer adequate, like, supportive services for people with complex medical needs and physical disabilities. So folks are saying more attention needs to be drawn to that. Homelessness is trending upwards in Philadelphia and across the country. So that could be one indicator of, whether this is working or not. I will say gun violence is going down in Kensington. It's actually dropped pretty dramatically in Kensington, according to city data. So that's something to note.
I'm curious though, like, does your reporting ever take you outside of Kensington? I'm curious to know, like, are there other neighborhoods that are struggling just as much, or like we need to also monitor other neighborhoods in this conversation?
Yeah, of course. I don't want to even say one neighborhood struggling more than the other, really. I mean, obviously the heart of the opioid crisis is in Kensington, but the city is dealing with homelessness and opioid use, open air, opioid use, across the city. And like, also, when we talk about the changing drug supply, like that affects the whole city. Like medetomidine is going to reach folks who are using drugs in any neighborhood. So then the effects of that drug are reaching everywhere. And it's a stretch on hospitals citywide. So it's not like Riverview is only for Kensington folks. That's the thing too. Like, I mean, Wellness Court is only Kensington, but Riverview's for anyone who completes an inpatient treatment program. So that's technically a citywide initiative. And, the city has citywide outreach workers, who will come out anywhere to engage with people and try to move folks into housing or treatment programs.
Emily Rizzo, accountability reporter at Kensington Voice. Thank you for chatting with me on CityCast Philly today.
Thank you so much for having me.
You can read more of Emily's reporting by clicking the link in our show notes. That's all for today here on CityCast Philly. Let us know what you think of this episode and share this with a neighbor. Rate the show, leave us a review, and hit that subscribe button. Be sure to sign up for our morning newsletter, Hey Philly, to learn more about what else Philly's talking about. And don't forget, you can support the show and get great perks by becoming a CityCast Philly neighbor at membership.citycast.fm. We'll be back tomorrow morning with more news from around the city. Bye.